Good morning, everybody, and thank you for joining today's webinar on school-based mental health education. My name is Kevin Driesen, and I work with the Arizona Rural Health Association. And together with our partners, the Arizona Telemedicine Program, the T-Health Institute, Empowerment Systems, the Regional Center for Border Health, and the Western Arizona Area Health Education Center, we want to welcome you to today's program. But also thank you in advance for spending time with us for this next hour and sharing any thoughts you may have on how we can improve and help school-based mental health education. So the next slide.
Got it.
Great. A couple just tips and notes. Please use the chat function to ask questions. And because we do have a great panel with us today, we'll hold the questions toward the end of the webinar to present them. Also, you'll get from the Arizona Telemedicine Program, you'll get a follow-up post-webinar survey just to provide any feedback about how things went. And then for those interested in receiving continuing education units, they will be offered through the Western Arizona Area Health Education Center, and a survey will be sent out after the webinar by Joanna, who is the director of the Western Arizona Area Health Education Center. She'll send out a little survey questionnaire. And if you fill that out and send it back to Joanna, she can work to get continuing education units for those that are interested in pursuing those units. Finally, the webinar recording will be posted to the Arizona Telemedicine Program's website 2 or 3 days, usually probably by next week, it should be posted. Next. With the last year and a half, it presented so many challenges around the state of Arizona, urban areas, rural areas, vulnerable areas, wealthy areas. We've all faced a lot of trouble with the pandemic. But we at the association have been getting a lot of feedback on the amount of mental health considerations that our communities are facing. And that led us in part to the selection of this topic. And we'd like to cover it in 3 different presentation areas. First, we'll be getting receiving a story about a scenario of a young person who is facing mental health challenges in rural Arizona. We'll be getting perspectives from the Arizona Department of Education about initiatives that they're carrying out around the state and have been carrying out, as well as some future initiatives that look very promising. And then we'll be getting 3 presentations from individuals in the field working to provide services in rural communities, mostly in southern Arizona, but also up in Yavapai County as well. So those are the 3 topic areas. We note that mental health issues exist around the state, but schools are particularly important and offer great resources in rural communities, as both for parents that have youth, but also they're important resource in rural communities. There are we've learned in planning the webinar, there are a lot of interesting initiatives taking place, a lot of good people working to try to improve mental health conditions. So the next slide would be, there we go. So the speakers. With that, we have 5 speakers. Ms. Carol Lewis is the Associate Director at Yavapai County Community Health Services, where she's worked for 32 years. She was born and raised in Phoenix and received a bachelor's degree from Prescott College and a master's in administration in health sciences from Northern Arizona University. Carol started her work in public health at Yavapai County Health Services in the WIC program, and then worked in community health education for a number of years before assuming her responsibilities as assistant director in April of this year. She teaches health and wellness for the University of Arizona's global campus. She is married to Michael and has 2 children, sons Josh and Mikey. When not working, she also enjoys the company of her 2 grandchildren, Paisley and Tristan. Jean Ajemi is a Deputy Associate Superintendent for the Office of School Safety and Social Wellness at the Arizona Department of Education. Jean is proud to lead some of the newer efforts at the agency for addressing mental and socio-emotional and physical health for students' well-being. Mr. Stephen King is a homegrown educator with more than 26 years experience, including 2 years as the Assistant Superintendent of Cottonwood Oak Creek School District prior to becoming the district superintendent. The Oak Creek School District is a rural district that embodies principles of classroom instruction that works, accelerated learning for all, and balanced leadership. As a breakthrough coach, trained superintendent, he's been empowered to put the focus on the focus for ensuring that strong classroom instructional strategies are being implemented with fidelity by spending time in classroom, coaching teachers, and building positive relationships with students. He has a passion for creating educational environments that support the whole child, with a strong focus on providing socio-emotional supports for children with traumatic backgrounds and intrinsic special needs so that they too may find success and educational attainment. Dan Landers is the Mental Health Block Grant Program Specialist for Arizona Complete Health, which is an Access Health plan that serves Southern Arizona. Dan created and oversees the YES program, and YES is an acronym that stands for Youth Engagement Specialist. And he oversees that program of behavioral health providers who provide behavioral health support directly on campus to 161 schools throughout Southern Arizona. Since its start in 2019, schools have referred over 2,000 students to behavioral health services through the YES program. Dan holds a bachelor's degree in political science from Arizona State University and a certificate in public health epidemiology from the Arizona State University's W.P. Carey School of Business. Inez Gonzalez is the executive director of the Behavioral Health Services for the Regional Center for Border Health, located over in Western Arizona, Yuma, La Paz, and Mojave counties. There, she oversees behavioral services, including program monitoring and program development. She received a master's degree in business administration and a bachelor's degree in human services from the University of Phoenix. Inez has been working with the Regional Center for Border Health for 11 years. Prior to joining them, she worked at Simpatico Behavioral Health of Arizona in Yuma as a community coordinator and for the Excel Group. Ms. Gonzalez has over 20 years of experience in behavioral health systems in Arizona. So with that, we'll begin and pass the mic over to Carol Lewis.
Okay, well, thank you for that introduction. So my name is Carol Lewis. My husband is also attending this virtually, and we're here to share Mikey's story. And my focus is on what pictures show and what really is happening in a parent's household. So the pictures that you see here is Mikey. He was born August 18th, 8 pounds, 8 ounces, 8 a.m.
Carol,
yes?
We don't see your sharing of your document.
We don't?
You have to hit the share at the bottom. There you go.
Do you see it now?
Yeah, and then just hit the slideshow. Yep, perfect.
Okay. So this is Mikey. What pictures do not show is a baby that did not sleep from day one, fussy through the night. And the picture on the right is a 7th grade picture. He's in 8th grade now. He's 13 years old. The picture doesn't show what we experienced on a daily basis, managing his emotions and outbursts beyond what normal teenagers do. And then you include puberty into that. It's extreme. I just want to mention that Mikey did give me permission to share this story. He just said, do not share it to my friends. The next slide is, the next slide is challenges being a parent with a child with mental health issues. Some of the quotes I got here is from another parent that lives in our Verde area. So just to get a glimpse of what we have to deal with here, especially in rural Arizona. Some of the things is a lack of available support groups for parents with a child or youth living with a mental health issue. Stigma attached to mental health. As one parent stated, there is a stigma attached to mental health issues. They see it more with older generations who believe mental illness is a mindset and our children need to just suck it up. There's a lack of understanding and compassion for what our youth are going through, especially since the pandemic hit. Lack of licensed child psychiatrists to test, assess children and youth. A single parent mentioned not being able to focus as much time on youth's mental health as I would like to, needed in order to help him. And the thing is being a parent, you always think it's not going to be my child. You don't think it's going to be your child. But doing everything you have to from the very beginning, from having a healthy and safe pregnancy, making it a safe and secure home for your child, but then finding out you have no control over a mental health illness. As parents, we are challenged every day, but also realize it's a chance for our growth and our patience. This next picture, again, is what pictures do not tell you. Mikey, at a very young age, was drawing at 2. Even before 2, he was drawing detailed art, fascination with puzzles, and also library books. What the pictures don't tell you is his obsession with those things and how it continues today. Unlike other kids, our son is not addicted to video games. He is fascinated with making crafts or creating things. Or if he wants a book series, he has to have every book in that series. The top right corner is when he was in kindergarten, he was diagnosed with Kawasaki disease. So at an early age, he became fearful of masks. He was in a hospital where nurses and physicians didn't know what he had, so they were treating him like he was contagious. And the next picture below that is him actually, after going to school from K through 6th grade, this was in 6th grade before he even became face-to-face with the mascot. Before that, he would run out of the room. He would go to his dad's classroom because he attended his dad's elementary school. We had a big thing right before COVID. Thankfully, he wanted to conquer his fears. We were able to do a Disneyland trip. So he was definitely able to conquer his fears through after that. Seeking diagnosis from COVID, Mikey was diagnosed at the age of 10. He was tested by a psychiatrist who diagnosed him with bipolar. In the 3 years, we have seen 4 psychiatrists. Living in rural Arizona, in our area, we've had psychiatrists that have moved out of the area to live somewhere else. And so we'll be seeing our 4th psychiatrist this December. During an emergency visit to the hospital, we connected with Teros Health, which is a mobile crisis unit. Since then, we have utilized Teros in our house during crisis, and they're free to any family. Doesn't matter if you have insurance or access. So that's been a blessing as far as our house. And we are also fortunate that Mikey does see a counselor weekly, Mr. Bill, as Mikey calls him, as this has been the most consistent thing he's had as far as his mental health journey. School support, this is what I really want to focus on. We were very blessed that Mikey is in the school that he is right now. He attends Branch Hill Mountain Middle School. It's a smaller campus of students. It's in Dewey. I was able to sit down with Jessica Bennett, who's the principal there, and she has made it a priority to create a culture of supporting students at where they are at. She values the importance where teachers are establishing clear routine and procedures that provide students with a safe structure. She promotes social and emotional learning throughout her campus. Mrs. Bennett extends this into instructional strategies where teachers can provide accommodations to help kids who struggle emotionally and or academically. Teachers provide notes, break lessons apart, and work with students individually. As much as students do not like rules, not having cell phones on campus and adhering to dress code and other rules provides expectations, consistency, and structure to the school environment. And this was a quote that she shared with me that I'm sure some of you have heard before, but the kids who need the most love will ask for it in the most unloving way. I'm sharing the picture on the right because this picture was taken by the principal and shared to me in the middle of the day, which really means a lot to me, knowing that she's checking in on him. The next slide is Mrs. Tricia Boyer has worked to ensure that social and emotional learning is implemented at Bradshaw Mountain Middle School. She regularly checks in with teachers and students and promotes the Believe in You curriculum. Every day in every class, the school takes the beginning of the morning 5 to 10 minutes to promote social and emotional skills, relationships, self-management, and responsible decision-making. The goal is less discipline, develop skills, and ultimately help them for employment skills. Each morning, a student writes in their journal, for example, what motivates you, conversations to learn more about others, and promotes empathy for some of the things promoted during this time. This is a walk. So Mikey, when he gets to that place where his anxiety and his stress is so high, she takes him outside and walks him around the track. And it really helps him calm down to be able to focus on what he needs to go back to finish. One of the things is math. Math is a trigger for him. He doesn't understand it. So this has really helped our situation. The school district applied for a school safety grant through the Arizona Department of Education to fund Tricia's position and additional positions to support other schools within the district. The grant was to provide a licensed mental health worker or social worker. If a student needs additional resources, the school referred to a behavioral health agency, Southwest Behavior, and the student can receive services for free. If the school is in need of assistance with a student in an immediate crisis, Terrace Mobile Crisis Unit is called to assist. Tricia also stressed the importance of having clear, predictable environments, no chaos, and the importance of a student knowing what to expect to create a safe and effective environment. If it wasn't for the school environment, I don't feel our son could be in school. One more slide and then I'm done. What is needed in our rural areas to address youth and mental health is a collaboration among healthcare systems, schools, physicians, and family support programs can offset the challenges faced by children and youth living in rural Arizona. Reducing the stigma of mental illness and behavior disorders among children and youth. We need more specialty mental health services for children and youth in our areas that are open to both private and access patients. And something that we've struggled as parents, and I'm sure other rural area parents, is that we need more inpatient services for children and youth in rural areas. It's difficult to find a place if they need more extensive care. And that's one of the quotes Mikey provided is, I'd rather say I have anxiety than bipolar. I just want to live my life. Thank you, everyone.
Thank you, Carol, for sharing your personal story and many challenges that I'm sure your family has faced over the years, but also some great school services that you've been fortunate to advocate for. So your son and Mikey is quite a lucky young man. Next, we'll be hearing from Jean Ajame, who will be talking a little bit more about some of the metrics that the Department of Education is following, looking at conditions around the state and also opportunities that may be emerging.
Thank you, Kevin. Get my PowerPoint up. And Carol, thank you so much for sharing your story. And I'm my heart is warmed that that the school was able or has been able to serve your son and other children so well. I can tell you that my team is working very hard to do that. And so I'm going to share some of your comments, Carol, with them because it will really lift their spirits. So I would like to start with some of the data we have both at the state and national level that articulates the need that we're really seeing, and I think many people are really ready to recognize now, but it's really not new for a lot of us. We have been partnering with the CDC since 2003 to implement the Youth Risk Behavior Survey in Arizona, and this series of questions has been concerning to me since that time. And here we have it for the year 2019 alongside the US data. And I know, according to the CDC, for both Arizona and USDA data has been climbing in a bad direction since 2009. So it's a series of questions looking at feelings of sadness and hopelessness that is going on for too long, you know, with also a lack of engagement in activities that typically are engaging, to seriously considering suicide, making a plan, actually attempting, and then actually having to see a doctor or nurse for some injury. And in 2 of the items, we are above the national average in both the first and in the last on this scale. So sometimes I hesitate to compare us to the nation, because if we're not as bad as the nation, we think we're doing okay. But of course, that's not the situation, because sometimes the nation at a whole needs improving. And this next slide, I wanted to bring some of the comments that we've received this year from what I consider our frontline workers with children and youth. So we surveyed our district emergency preparedness coordinators that we work with on an ongoing basis prior to this emergency over the years, but we surveyed them in the spring and asked them about their top 3 areas of concern for the upcoming school year, so the school year we're in. And mental health ranked in the top 3, along with instructional concerns about instruction and possibly needing to catch students up, and also staffing. And that's been in the media quite a bit. We know the additional impact that the pandemic has had on staffing in schools. And we surveyed them and our school nurses for the purpose of not only understanding the situation, but to develop our professional development plans for this year. With our school nurses, we had a very good response with the school nurses, and about 400 responded to our survey. A little bit less than that responded to these actual questions, but they identified mental and emotional disorders as the 3rd most frequently seen chronic health condition in their office. And so that's a very interesting a point, then, that our nurses are being relied on for mental health. And I know that the reverse is true, and sometimes in schools that don't have school nurses, our school-based mental health folks are being called upon for physical health interventions. So, so this was really helpful information to us, and 71% would like training on mental health screening. You'll see that we have started planning that. And for this population, mental health is the #1 remaining pandemic-related need. And then we received information from the Arizona Pediatric Healthcare Coalition. It was a kind of a plea to us and to schools to do what we can to serve students at school because of the pressures put on the healthcare system. You may have seen just this last week a statement put out by 3 major pediatric organizations in the nation, and it basically is supporting what we've heard in the state. And I'm not going to read the whole thing to you, but I'm hoping that these slides can be shared. So if you want to look up the article and see just what they're sounding the alarm on, basically. Okay, so let's start getting into the positive and the strategies that are new or have been out there for a little bit now that can hopefully make an impact on this data. So recently, in the last legislative session, SB 1376 was passed, and in a nutshell, what this statute did is required that mental health instruction be included within any health education instruction in our K-12 education system. And so it was just very recently when the rules made it out of the State Board of Education and became effective just October 26th. The bullet points under that, so that this is a really good start, and I don't want to minimize the potential here, but it's really important to know that we have a very weak requirement around health education to begin with. So this might not be quite as strong as it could be if we had a stronger health education requirement. So for the elementary and middle schools, the rule reads health/physical education is required, and that has been interpreted as health or physical education. And then within high schools, it's an option. So what we really see in real life is some health being offered within PE, which is good, some standalone health education, but we've seen a trend utilizing another CDC tool called Profiles. We've seen a downward trend in the requirement of health ed for graduation. So it's something we could use help on should there be interest out there. We will be sending out guidance to our schools next week to support them in the implementation of this new requirement. And much of what we've been doing in the agency over the last few years is already really relevant, but we point out a new tool that could be really helpful called the KeyCat, helpful in assessing what they're offering in the way of mental health within health ed. We're also taking the opportunity to explain some terminology and definitions because these are education professionals and not necessarily experts in health. When we present strategies or supports to schools, we like to present them using public health prevention pyramid with an emphasis on the green area, meaning the universal preventative types of activities that could be done. Health education is a perfect example of that, as well as positive school climates. And then when that is done, as we explained, you are going to be serving 80% of the students and leaving far fewer that need small group or individualized assistance. We modified the pyramid a bit though for right now, particularly, and I think we're going to keep it like this forever, to emphasize staff supports as the foundation of the pyramid. It has been an overlooked piece. The department, though, fortunately has for the last couple of years, because of the staffing crisis and then more recently with the pandemic, has been able to put some really good emphasis on support for teachers and support for recruitment and retention. And one of our projects during the pandemic has been in partnership with the State Health Department and Access. And we were able to utilize a behavioral health agency specializing in employee assistance programs to train 20 peer coaches. So these are teachers and administrators or recently retired that want to be trained, have been trained, and want to provide assistance, prompt, free of charge, confidential, of course, to an educator in distress. And it's a way of reaching people who might not have access to a clinician or may be uncomfortable with the idea of therapy. But the coaches are backed up by clinicians and know when it's appropriate to refer on. Anything you can do in helping us reach, get this message out wider than we are in your own areas, we would really appreciate it. And then Carol mentioned the school safety program. I'm really, really pleased that the social worker Bradshaw Mountain was able to hire is being really helpful. That was anticipated. Through some advocacy of the March for Our Lives groups and other education groups, the school safety program was expanded from funding only school resource officers to now funding school counselors and school social workers. And through the regular program, we were able to fund 380 of these positions. But the Department of Ed chose to use some of its own pandemic funds to award another 180 schools for counselors and social worker positions. And these positions, as you heard with Carol, they're in Prescott, they are statewide. We're in all 15 counties. With these funds, we were able to loosen or broaden what's acceptable, I should say, as far as criteria and credentials for the positions. And we did that particularly so that our harder to reach areas will have a better chance of filling the positions, because we're not completely sure that all the manpower is there. But we're being as creative with folks as possible because we can and we want to. And then very recently, through a partnership with the State Health Department once again and the Arizona Nurses Association, we're going to be able to hire 60 school nurses for rural and underserved areas. We're pulling the data right now. Rural will be one of the primary data points in this calculation in how we determine who's going to be eligible. It was also a consideration in the School Safety Program Awards, I'd like to point out. And there also will be an intensive training program and a plan for feeding that pipeline. So with all these, and I do think that this is probably some of the most important work that we're doing, is getting very qualified and trained hands to help with the situation on campuses. We are looking at a financial cliff in 2 years. The funding supporting all this is going to be gone. And so that's something we're going to really need help with. And we offer a variety of training, suicide prevention training. I mentioned earlier, our nurses are concerned about having to deal with mental health. And so our first training directed at them will be going on next week. And we have ongoing, the whole agency has ongoing training around social emotional learning. Much of this now, of course, is distance-based, good and bad, but it's turning out to have a lot of benefits. Some of this also with the suicide prevention might be able to be done in person at your location as well. So give us a call or an email, please. And I'm sure I'm like way over, but I would like to talk just very briefly. Also, we don't offer training per se as of yet, but we've trained a cadre of individuals that are able to deliver an evidence-based behavioral threat assessment program around the state. And this is an in-person training. The significance, there's a lot to say about school-based threat assessment, but in a nutshell, the significance of this is that threats are made all the time on campuses by students. It is very, very rare when it is a credible threat. What you want to do is use a protocol such as this before even calling in necessarily outside authorities, because it will allow you to discern the credibility of a threat and provide the resources to students that need it. And as an alternative to simply a threat is made, kicking a student out. There's a better way, and there's terrific data to back it, a better way to handle threats we experience on campuses. And we also, we promote a document that we put out earlier this year in partnership with Access. Bradshaw Mountain was doing this as well. It sounded like they have a good relationship with their behavioral health agencies in the area. And that's really important because a school needs to be able to recognize when they are beyond their expertise and when they need to refer. There's a lot to that. There needs to be a policy and a referral process. They need to get on the same page with terminology. One of the biggest items you see right away is that the term behavior means something different to educators than it does in our behavioral health system. So that's addressed in this document as well. And finally, I want to talk about a new grant that's coming out from the agency. It's supposed to be announced tomorrow, but not actually available for a couple of weeks. But this is available to government entities, community-based organizations. I asked if they have to be nonprofit. They do not, but this could be of interest to your organization, that it will be funding available to address 3 priority areas, and one of which is around student mental, behavioral, and physical health supports. So it's exciting for me to see the elevation of mental health as a priority. I'm sorry to see kind of why it has risen to this point of actually having the recognition it needs. But here we are with some good resources. And I appreciate any collaboration we might do together, because we certainly can't do this ourselves. Thank you.
Thank you, Jean. And it's a big state with lots of problems, lots of people, and you've got a big scope of work. Thanks for sharing the data, clearly reflecting the importance of mental health considerations. Let me pass the mic over to Steve King, who's up in Cottonwood and has another strong perspective as a superintendent of school system.
Yes, thank you, Dr. Eason. And a couple of thank yous before we get going. I loved what you had to say there. I hope you're saying your name right, Miss. Is it Jamie? Am I saying your name correctly?
Ajami.
Ajami.
Ajami. You say it very nicely. And really, I answer to anything.
Okay. yeah, I know that feeling. Usually it has other connotations, but I loved what you had to say. And I also wanted to, I hope Carol's still on here, and I do see your name there, but Carol Lewis and I have worked very, very closely together over the past 19 months. And she can attest to since this pandemic began. And I'll tell you, anytime I call on a Sunday night at 10 o'clock, 11 o'clock for advice on quarantines and COVID and all that craziness that's been happening, she's been right there. And she is a remarkable individual who's always a joy to speak with. And I had no idea you've alluded to a little bit in the past, but nothing like that. And it was truly inspiring to show what the differences you can make and what some of the challenges are. I am the superintendent of Cottonwood Oak Creek School District, and this is my 5th year as superintendent. And I've been in the Verde Valley now. If you haven't been to the Verde Valley out there, it's a beautiful place. I moved here with my much younger family 20 years ago. It was kind of a return home. This is where my grandparents were from. My father decided he did not want to live in the Verde Valley. It was too small, so he got out and said, I'll never go back there. Well, I wanted to get out of Phoenix, where I grew up. And so we moved up here 20 years ago, and it is an absolutely beautiful place filled with wonderful, wonderful people. But it was certainly an awakening to different kinds of culture and different challenges up here 20 years ago. And I've been mostly in alternative education my entire career until I became a superintendent, working mostly with high school kids, but of all ages. And what I encountered in the Verde Valley when I first moved here was generational issues, generational poverty, generational sometimes traumas. We have a significant population. The vast majority of our children are coming from poverty. We have a large Native population, the Yavapai Apache tribe here. And for many years working here, for about 7 or 8 years, I was lost in trying to understand what we were seeing. And around that time, a friend of mine, Erin Mabry, who works with Big Brothers Big Sisters, she turned me on to something called ACEs. And I'm sure all of you out there are familiar with ACEs and adverse childhood experiences. And what that did for me was like my road to Damascus moment, or the great epiphany and the awakening of understanding, beginning the understanding of what we're seeing with the children that we have up here. And for those of you that don't know, I'm not going to go into the details of ACEs, but basically those are bad things that happen to kids when they're young that affect them, traumas that affect them. It could be substance abuse in the family, it could be physical, emotional, sexual abuse of some kind, and those are cumulative effects on children's well-being. And the more of those ACEs or adverse childhood experiences that they have, the greater issues that we could possibly see, health issues as well as academic achievement, as well as life issues, especially manifested once they become adults. So that changed a lot of things in my perspectives. Also, the work of Albert Ellis in cognitive behavioral therapy, and has had great impact on my view of okay, well, what are we going to do about it? That's what it always comes down to. Okay, we understand these things. We understand that people have problems. We understand that children have issues, growing issues. But what are we willing to do about it? We can't change the past. We can't change the circumstances of what they've been through. Also goes for ourselves. But we can affect how we view those things, the lens we look at those things through, and say, okay, what are we going to do about it? So 4 years ago, a little bit more than 4 years ago, I became superintendent of the Cottonwood Oak Creek School District. And the first thing that we realized as a district, when I say we, this has been an absolute, and everybody's probably say, oh, that you say, everybody says that, but it's absolutely true. I am surrounded with people much, much smarter than I am, who understand genuinely, both the heart and the head, that we needed something more. We needed to look at things a little bit differently as far as our schools go. And we focused on the cultural pieces first and foremost of what we were doing. And so the first year we began this process, we reorganized our schools. So we had 3 schools, and they were a K2, a 3-5, and a 6-8. And the kids would all the kids would start in the K2. They go through that together. Then they'd all go off as a cohort to the 3rd through 5th grade school. And then they would go for 3 years there. Then they all go as a cohort off to the middle school for 6th through 8. And then they would all go off as a cohort for 9th grade up to the high school, which is not in our district, but it's a union district. So they took all of our 8th graders going to 9th graders. And that model was brought in about 14 years ago to address the disparity and some of the inequities they saw with achievement levels between some of our minority kids as well as our other kids, as socioeconomic across the board. And it worked, it solved that problem. But what we saw was increasing, we had families that had children in 4 different schools. And if we're really trying to build culture and trying to build, everything's founded upon relationships. And then that's, in my mind, everything is a prerequisite to any kind of quality education is a quality relationship, not just with the teacher and the students, but also with the schools and the families, and then the students amongst themselves. And the structure we had with all those different schools did not really lead to that. So we took those 3 schools and we reorganized them into 2 K8s. We like that K8 model. I came up in the Washington School District down in Phoenix, and I went to K8. I liked it, but more than that, we had families staying together so we could start building those relationships to them. So that was our first piece, is looking at the cultural and building the infrastructure and the ability to serve those students, get to know those students, because you got to know who they are. The other thing we brought in was starting to look at the different programs and processes that could help us. We looked at PBIS, we looked at Capturing Kids' Hearts, we looked at a lot of different aspects, but that base cultural model. So if you're familiar with MTSS, which is the multi-tiered system of supports, that tier 1, what everybody does is absolutely crucial. You check in with these kids, you get to know who they are, you shake their hands, you get to make those phone calls home to the families, you build those relationships. That is the tier 1 piece. So we brought that in. At the same time, walking and chewing gum kind of thing, we also found that we did not have a whole lot of counselors in our district. And that was the first thing I heard when I was assistant superintendent. We need more counselors, we need more counselors. These kids are having issues. Okay, I understand they're having issues, but we need more counselors. Well, I love counselors. And by the way, thank you, Gene, because that school safety grant, we've been the beneficiary of 3 of those school safety, 2 counselors and a school resource officer over the last 2 years. And we've increased our student supports, not only through that grant, but through also private funding. We call them our focus zones. And our focus zones are now at every campus. It began with a very small pilot grant through the NARBA Institute of $25,000, and it's grown to every campus, multiple focus zones in some cases. And we've gone from 0.7 counselors or student supports workers, that's a half-time FTE, and 1 person was working 1 day a week, to 9.5. And that's all done through private funding as well as through the state grants. So I'm very, very appreciative and very grateful for all the work that's been done on that. So those focus zones have been absolutely crucial in giving those children spaces. It's a little bit different concept than traditional counseling, although we also have that. Focus zones are places where students can go learn how to regulate. And there's 3 key words that we're using them here. There's regulate, there's relate, and there's reason. So regulation is from the brainstem, guided through the brain science that we've been doing as well. And so they have to be able to regulate. The relationships are the chelate, or the mechanism that helps the reasoning happen, because a child who's dysregulated is not in any condition to learn. So they have these spaces where they can do activities, get regulated, and go back to class. We want to see reduction in our discipline issues. We also want to see an increase in attendance as well as child well-being. Those have been guided by another initiative that's been brought into the governor's office, and the governor's office has been very, very good to this district as well. And this is on the neurosequential models of education, of therapy, and community. And neurosequential is the work of Dr. Bruce Perry. I don't know if you're all familiar with what his work is, but what it comes down to, and this is very much an oversimplification, is that different traumas affect different parts of the brain at different times. For example, it could be all the way from prenatal all the way through today, what it might be. And different parts of the brain are affected by those traumas. So it's a brain mapping, but again, it's also an understanding the brain science of where these things are coming in, and that has guided us as well. The fourth piece to what we've done is something called the Iceland model. And if you're not familiar with what has happened in Iceland, Iceland has been absolutely remarkable in their development of their programs for students and children. And recognizing, in just a quick summary, Iceland 25 years ago had the highest teen substance abuse rate in Europe. Because what else are you going to do in Europe except get high and get drunk and carouse and cause all sorts of problems? Well, Iceland recognized that they had a problem. That's the first thing is, hey, I got a problem. But the second thing is they brought in the brain science to understand why people use substances. And again, this is an oversimplification, but I'm a pretty simple person. So that's pretty much all you're going to get is oversimplifications from them. But what they realized is that when you use substances, you're trying to do one of two things. Either you're normally high and you want to use depressants to get brought down, or you're normally low and want to use a stimulant to get to that stasis level where you feel comfortable. But they also discovered that you can get those feelings and that state of being through activities, things that you enjoy doing, those things that you can go into that zone, whether it's music, whether it's art, whether it's dance, whether it's athletics, whatever that might be. But they did something novel there is they asked the kids, what do you want for after school programs? And the kids told them, and instead of the traditional sports, which they still had, they started adding these different programs, after school programs for kids, these extracurricular activities, not only giving the kids what they wanted, but also, wearing them out. So by the time they got home, hey, I had a good time at school. So we have used that model in Iceland as well in our district through these additional extracurricular programs, again, funded through private grant funding as well as through the 21st Century Learning Grants. So the two pieces were brain science, after school programs. The third piece was law enforcement. And some people may say, law enforcement, well, yeah, well, it's true. In some cases, our families, these children are staying home, missing school, chronic absenteeism, dropout, generational issues across the board because of decisions their parents are making. In my mind, if you're not sending a kid to school for an adult issue, that's a form of child neglect, because we know that these children will drop out of school once they're allowed to drop out. So we're trying to reduce those numbers. And hence, if they drop out, lower achievement, lower income levels, higher mental health issues, as well as substance abuse issues. So we work very, very closely with law enforcement. And those were the three pieces of the Iceland model. And our law enforcement partners with the Yavapai County Sheriff's Office as well as Cottonwood PD have been outstanding. And the fifth piece that we brought into our schools were responsive classrooms or restorative practices. And you'll see those as well. Circles, as well as the understanding that you can fix and help heal relationships and restore those relationships, not just amongst the students themselves, but also amongst the community, and understanding and coming with that premise of listening first to try to find out where those are coming from. But I think the biggest thing that we've seen, and I will summarize, and I'm sorry I don't have actually PowerPoints, that's we won't go there, but I think the biggest thing that we're seeing with our children nowadays is there's a lack of hope and there's a lack of vision for what they see for the future, especially poor kids. They just don't see themselves doing anything else. And now that I've been up here 20 years, I'm seeing the children of the children that I had when I first started up here increasing. And they're so cute. They're like, oh, you knew my mommy. I'm like, oh, I sure did. And they're wonderful, wonderful people. But we are in the business of trying to break cycles. And that's what is giving us great hope. But we have to help these children find the hope and the vision for themselves that they can be something more. And I think that is the biggest need, but it's also at the same time the biggest challenge that we are facing. And I think the pandemic has been, it's been a hell of a thing, but the pandemic has only accelerated what we've already been seeing over the years. And it's becoming more manifest. And more than anything, I think we're seeing with the pandemic is not that the children, but the stressors and the adults, the issues that we are seeing with the adults that we also are part of our families and part of our cultures. There's rarely a day goes by that I don't get a phone call from somebody very, very upset over something that, 2 years ago, it wouldn't have been any issue. And usually they're just looking for somebody to listen to them. So there's a lot of work that needs to be done. We're just playing around with this. I don't have a master plan, a master strategy. We've just been kind of building it as we go. But we've had excellent, excellent partners. Yavapai County Health Department, Carol Lewis has been one of them. But that's where we stand at, Doc. So I appreciate your time. And
Okay.
that's all I have.
Can you turn me on? Thanks, Steve. That excellent presentation and a good description. One can tell from your energy that you're the right person for that job. I can say that we did receive a question from Stephanie Martinez, who asked how the switch to K-8 schools affected students. And have you seen an increase in behavioral health issues by mixing the range of ages?
Yeah, so we are now in our our fourth year, and not one of those years has been normal. The first year was, was kind of chaotic. The second year we were doing okay, and then the pandemic hit. Third year was pretty much all pandemic last year, and we did stay open more than and Carol will attest to this as well. More than most schools across the state. We found the importance of getting back to school because of those issues that we were seeing increasingly in the community, the child abuse and the referrals to DCS and all that. So we understood that it was imperative for us to get back. We are now, this year, we are finally starting to see the fruits of our labor, so to speak, where we're seeing more connectedness. We're seeing those cultures really starting to flourish. We're also, with the K-8 models, we're also keeping those brothers and sisters together. For the most part, has been very positive, but we're also seeing the collaborations across with those older kids going down and getting down those younger kids, and not having to show off so much, is they're more connected with the entire school culture. So I think that's been the biggest benefit of that. As far as the academic achievement of that goes, it's kind of tough to measure right now because of all the disruptions. But we are seeing pockets of that as well. As far as the mental health goes, seeing the continuum, and I think this has probably been the most beneficial, is our teachers and staff are not working in silos, only understanding, okay, well, I've got middle school, 6 to 8. Now they are seeing, okay, now I understand why. Instead of blaming the previous school, I mean, everybody likes somebody to blame, right? Well, instead of blaming the previous school, it's not a blaming, it's an understanding of the continuum and how children develop those sometimes negative habits at a very, very young age. So one of those things that we've done as well, and this just happened 2 weeks ago, is the county, through the Juvenile Probation Office, is funding what we call a probation resource officer to work directly with our principals and administrators to identify those students at an early age with their chronic absenteeism, and to get them into diversion, work with those families to identify what those barriers are to coming to attendance. But again, the K-8s allow us that continuum to say, okay, well, it's not, stuff just doesn't happen overnight. There's a reason. If there wasn't a problem, there wouldn't be a problem. That's a saying that we use quite often in our district. And that allows us to look deeper into what those issues might be, and says, oh, the kid's not at school. Well, that's not the problem. That's a symptom of the problem. What is the problem? Is it a transportation issue? Is it a housing issue? What exactly is going on? Discovering those issues and trying to help ameliorate those, at least to some degree. So I hope I answer your question. I get a little wordy sometimes.
Okay, thanks. I think you did. And let's pass along, and I should waive the warning. I think that we'll go a little bit over time after 12 o'clock. We have 2 speakers yet to go, and let me pass the wand over to Mr. Daniel Landers from Arizona Complete Health. You're muted yet, Daniel.
Hi, everybody. Let me just share my screen here, and we'll get through this as fast as we can. All right. So let me start telling you where we're at. So with Arizona Complete Health, we oversee we're a health plan for the access plan. We're also the regional behavioral health authority who oversees the crisis system in Southern Arizona. In that, we monitor the amount of mobile crisis teams that are sent out and called through the 24-hour crisis hotlines, and the crisis mobile teams get dispatched out to the community where they're needed. We looked at during the amount of crisis mobile teams that are going out during the school hours and school day, school year to children and school-age children, and so this is kind of what we discovered. In this vertical line, you have the number of access, you have the number of crisis mobile teams out to youth. And on the horizontal line, you have the number of schools in the county. And what you see is we realized that Pima County was high, Cochise, Yuma, Pinal County all had a lot of needed some support there. So we developed a program based upon seeing this, that there was definitely a need in our schools, and that is that when a crisis mobile team comes out, the child has already had a mental health crisis. But if we got ahead of that and we're able to get those children into services sooner, there probably wouldn't be a mental health crisis. So we could lower the amount of mental health crises out in our community. So we developed a partnership. We created the Youth Engagement Specialist Program, and we partnered with Costa de los Niños and with Tucson Unified School District in 2019. In Tucson, approximately 80% of the children that in Tucson go to a TUSD school. We were approved by the governing board, and then we started in April 1st. And now if you fast forward to today, Costa de los Niños is now working in 69 schools in Tucson, and that's across the TUSD, Sunnyside, Amphi, Flowing Wells, and charter schools districts. And last year they had 742 referrals, and that's grown. And originally this program went from 10 schools in TUSD school to now 69 schools with just this provider. We then expanded the program and brought in Intermountain, then another behavioral health provider, and they expanded into 16 additional schools, schools on the TO Nation, also in Casa Grande and in Yuma. They then, this current school year, are expanding into Nogales, Rio Rico, Douglas, and Sierra Vista, and they had 269 referrals last year. We also expanded into Pinal County. And we have let me go way back one more. Intermountain also is in Yuma Union High School District. So I didn't include that, but they're now currently in all high schools in public high schools in Yuma and receiving referrals. Then in Pinal County, we are in schools in Eloy and in Casa Grande. We awarded funds to Horizon Health and Wellness, and they last year had 171 referrals. If we look here, this starts with the very beginning, April 2019. We had in that very first month of this pilot program, we had 69 referrals. And if you look through, here's that first year that ended, essentially ended the school year that 2020 ended in March. That's when middle of March is when schools got shut down because of COVID. But we still got, even through COVID, we got referrals through here. And then last year, even more referrals. But now take a look at these recent months in this school year. 220 referrals in August and 370 referrals in September. So the amount of referrals are now through the roof, just really showing the need and the effect of COVID and some of this trauma that children have been experiencing. Also, now that these networks and these are built with these schools and in this program, you're seeing the fruits of this labor and the referrals there to address the needs. Funding streams there's several funding streams available to help all children. Any children on access can get served here in Southern Arizona through Arizona Complete Health, Banner, United Healthcare, or the American Indian Health Plan. Then there's also the mental health block grant that's available. That is for any child that is uninsured or underinsured. So uninsured can include undocumented students, and underinsured includes children with commercial insurances that don't meet the parity level of, say, for instance, the behavioral health benefit under the Medicaid plan. There's also, this year, the legislature has enacted the Jake's Law funding. This was Senate Bill 1523. And you had it's the payer of last resort. It can cover what commercial and mental health block grant cannot cover. So with a school-based referral, so it's extra money available for children. And then in Pima County, they have a COVID relief grant, and that grant will help cover expenses for behavioral health outreach to schools. In the YES program, if you look at quarter to quarter here, and to see where we're at, you can see this steady growth as providers have expanded, and the word spreads among schools and school districts to be part of this program, and it is expanded throughout Southern Arizona. And that is all I have today.
Again, thanks, Daniel. And the YES acronym stands for Youth Engagement Specialists, and it's an exciting model that Arizona Complete Health is supporting, providing services on campus. And we were really excited to learn about it. Let me pass along. We're almost at the end of the hour, but we'll expand. We're very interested in hearing from Inez Gonzalez from the Regional Center for Border Health. And welcome. You're sitting, I can tell, in Somerton, Arizona, Inez. Welcome to the webinar. Thank you for taking time. You're on mute yet, Inez.
Can you hear me now?
Yes.
Okay, so I know we have a little bit of time, so I'm gonna go through them as fast as I can. So here we are at Regional Center for Border Health. We are the San Luis Walk-in Clinic, which we are integrated with behavioral health services. And I'm just gonna go ahead and give a little bit of information what we're doing and collaborating with the schools here in the South Yuma County area. So we are a patient-centered medical home. We cover the whole Western area, which is La Paz, Mojave, and Lake Havasu. So we have offices, and our headquarters is here in Somerton. We also are an integrated facility with behavioral health services. So we are receiving a lot of referrals from the schools lately, and also from other agencies. So when people come in and we receive the referral, the first thing that we do is we make an appointment with the primary care physician, and then we collect those social determinants, and then we do the referral to the behavioral health department so that we can capture both the HEDIS measures as well, and also to ensure that all children are immunized and everything has been up to date. Currently, right now, we are receiving 70 referrals per month. So that's between adults and children. So we've been doing a lot of intakes. We are also working with the Yuma Union High School district on referrals with speech. Speech has been another department that we've been receiving a lot of referrals on a monthly basis. It's about like 45 referrals that are coming in. We also have an MOU with the Somerton School District. They send us the referral with a release of information, and then we ensure that we send the date when the appointment is scheduled, and also we ensure that we send a copy of the assessment and with the care plan. We also have our family care coordinators, who are the case managers, who also participate in the IEPs. And we also attend the CFT meetings, which is the Child and Family Team meetings, to ensure that that everybody's in the same page with the teachers. What is the care plan for that child, to ensure that we are covering that counseling service in our facility, or if they need other referrals, such as another specialist like speech or OT. So making sure that all of those referrals are done. We also have Dr. Bailey, who does the psychological testings, evaluations. So we make sure that the teachers complete the ADHD observation forms. And we also do school activities with the children. We do the nutrition classes for kids and exercise classes with in the schools. Another trend and diagnosis that we've been seeing a lot is that there's a lot of kids coming in with autism and ADHD, speech delay, school violence, a lot of bullying. There's a high dropout rate in the Yuma County area, in the Yuma high schools. There's a lot of teen suicides that we've been seeing, and also a lot of substance abuse with the fentanyl currently with the pandemic. Currently, we're working with the juvenile probation to offer the MRT group, which stands for the More Recognition treatment. Most of all of these kids are in the Aztec high schools, so we try to work with them as well. And we have a very good communication with probation as well. And the other, we also have the school-based services. Currently, we have not been able to provide counseling services into the schools due to the pandemic. However, we do go into the schools to de-escalate the crisis situations. The nurse gives us a call and tells us that we have one of the members, so we go in to see what was the trigger or what's going on. Also, we've been having a lot of barriers, especially for the uninsured population. There's a lot of parent worried about financial constraints. However, here at the San Luis Walk-In Clinic, we assist them with the sliding scale fee. We offer CAPAS. Our CEO has been very generous in waiving some of those fees if people cannot pay for those co-pays, or even sometimes waiving the whole assessment fee or primary care fee. So we try to work with them as much as we can. But the barrier is the cost of the psychotropic medication. That is very expensive. So when the member goes to the pharmacy, they don't have the means to pay for that medication. The other problem that we are facing is the stigma of mental health, and also the shortage of licensed mental health providers. We need more counselors, more psychologists, and more psychiatrists. However, we are very lucky that we have 11 licensed counselors working with us right now, but still there's a very much shortage, and especially also in speech language pathologists. We need them. And another barrier also is transportation with the uninsured population. They don't have transportation. However, for those members that do have access, we coordinate the access transportation. We also provide transportation ourselves, but it's those that live outside of the outskirts of town that they're facing these barriers to obtain the services. And another, we also have the NEED community and school-based intervention programs. We are integrated program of education and prevention to the schools. Currently, we are establishing an MOU with the schools to provide telehealth visits at the San Luis Walk-In Clinic, including behavioral health services as needed to identify those areas that we need. We are exploring right now. We're doing a pilot project with the Head Start and Lake Havasu. So we will see how that works and doing televisits with them. We also, the other services that we also provide, we give out presentations on anxiety. As you can see in the picture, we hand out how to manage your anxiety during COVID-19, because that was a big issue during the pandemic. But we also monthly educational workshops on a monthly basis. We present them, and also we conduct behavioral health presentations and primary care presentations to the migrants programs. We go into the schools to speak with the counselors when they have in-service trainings, PTO meetings with the teachers. So we try to outreach to the schools so they know that we have all these services available in our area. We also have the Autism Center. We have 2 ABA therapists. Currently, we're running 2 ABA parenting skill group, one in Spanish and one in English, and they focus on the diagnosis process, the autism spectrum disorder, the behavior issues, and teaching new skills to the parents. Before the pandemic, we were doing a lot of the youth mental health first aid trainings in the community. So we train counselors, law enforcement, and teachers. However, right now we are in the process of certifying more staff to be certified in the youth mental health first aid so that we can start with that process again of training more people in the community and how to see the signs of mental health diagnosis and how you can refer people to these services. And this is all for me. Do you have any questions?
Great, thank you, Ines. And I'll tell you, my head feels like a balloon, really, that's getting bigger and blown up with really there's a tension because you realize that there are all these programs and good efforts taking place around the state in rural communities. But on the other hand, you realize, boy, we've got a set of very difficult circumstances with people that are suffering, very difficult mental health conditions. Before we move forward, I just wanted to thank all of the speakers for taking the time and to be here this morning and to prepare your presentations. Thank you all for the work that you're doing on an ongoing basis and what you have been doing and what you will be doing. So I wanted to just make sure to thank all of the speakers. Then
We need to ask Ines to stop sharing her.
okay,
screen.
Ines, if you could stop sharing, then we'll
We'll wrap it up.
we'll wrap it up. Great. So I'm on the slides. Great. So. So thank you to all the speakers listed. In terms of next steps, to the next slide, please. The video recording will be posted to the Arizona Telemedicine Program's website, as will the presentations. Once we get permission, we'll make all the presentations available through the Arizona Telemedicine Program and to our Arizona Rural Health Association websites. Again, if you're interested in receiving continuing education units, Joanna will be sending out a follow-up email survey that you'll need to complete and return to her at the Western Arizona Area Health Education Center. We wanted to note a couple of events. The November 5th, the Arizona School-Based Health Alliance is hosting their annual meeting, which is a free event. You can register on their website and it addresses a lot of these same issues, but also they'll be looking more closely at the Medicaid school-based claims process that is being adjusted a little bit. And ASRA is looking at doing a following up webinar as well with a focus on how to provide clinical services on campus with support from the Medicaid school-based claims program. The couple websites on there for more information are our website and also the website of Empowerment Systems, who is a planning partner. Before we close down, again, I just feel like on the one hand that we've heard about so many great programs, really good people working around the state with support from the Arizona Department of Education. Yet there's a lot left to do. I mean, Steve, any thoughts of how we can make things better moving forward?
Are you asking me?
Yeah, I mean, you're at the school.
Yeah.
You're there.
Yeah, so I think making things better, you said what are the legislative priorities? I think really the understanding needs to be there at the level of leadership of what we are seeing. And I'm not speaking for anybody, but I'm sure there'll be agreement out here. What we are seeing out here in the field is in many cases extreme. We are quickly approaching and probably have already surpassed a critical mass of students that is affecting the whole, that are coming to us with challenges that we have not seen before, things that I could not imagine when I was going through school in Arizona, in Phoenix, just I don't say on a regular basis, but we because of the things that we've been working on, I think we're in a little bit better position, but still the issues of the children are growing exponentially. And I think right now, one of the things we are seeing, especially with the social media stuff, especially with the levels of technology that we are placing in the hands of very, very young children, which is, I think, is a huge challenge. I don't know what else, mistake. And we are seeing those things manifested on a daily basis. And I believe that we're also starting to see the physical component. That's what I would be getting more and more interested all the time, is the physical component of what we are seeing with children, and the changes in brain structures, but also the changes in their diets, you know, as far as the obesity levels and the inactivity. And that's what it goes back to, as well as these Iceland things, getting these kids outside in the sunshine, doing positive activities. And that's part of the Iceland model that we've done. And we've increased our students participating after school programs by 500%, 5 times as many. But they got to get outside, get off their devices. This whole technology thing, and I was just at a webinar on bringing more technology into the schools. I'm like, we got enough stinking technology. We need to get these children moving. We need to get them in the sunshine. We need to get themselves interacting with one another, and those social skills that are so absolutely vital that they are lacking because they're on their stinking devices all the time. I read an article where I'm just as guilty of it. I'm not a hypocrite. I'm preaching to myself as well. But we check these things 86 times a day. For what? You know, for nonsense usually. And I think it is having a severely detrimental effect on children's emotional and mental health, as well as their physical health now. So I don't know if I answered your question, Kevin, but it is.
No, that's a good summary point. And again, a lot of good information provided. Inez, thank you very much. Jean, Carol, thank you for sharing your story. Daniel, thank you for telling us about the YES program. All the speakers, thank you very much. I think we've run out of time. Not the energy, not the points of issue to discuss, but at least for here and now, we have to call it a day. But thank you all very much. And thank you to the audience for joining the webinar.